Hello and welcome to our session on health promotion, something we've been talking about one way or another for the entire semester. But today I'm going to concentrate a little bit more on the practice of health promotion to help us understand this in relation to the Sustainable Development Goals. So what is it? Well, it's a process of enabling people to increase control over the determinants of health and in turn improve their health. So the key words here are process, which indicates that it's not a one-off or isolated event, and enabling, meaning that we don't do things to people, we facilitate opportunities or interventions or programs that allow people to have control and agency in relation to their health. So it's a process of enabling people and communities to have control over the determinants of health, something that you are familiar with by now. So this is the socio-ecological approach which health promotion is based on. This is the original model that Dahlgren and Whitehead used in 1991, and as you can see there are individual factors, individual lifestyle factors, social and community factors, general cultural and environmental conditions. I would add to that now the biosphere, which we have also been talking about this semester. But as you see, this is the socio-ecological approach that health promotion is built on. So determinants of health are both individual and community-based or population health issues, and that's what health promotion aims to do, to improve that health. As you see here, the determinants of health are wide-ranging: economic, political, cultural, environmental and social, and can be potentially altered or influenced. So looking at health through this lens helps us develop responses that are likely to be successful in promoting health. A little bit of history. The Ottawa Charter for Health Promotion was a landmark document developed in 1986 at first International Health Promotion Conference, where health promotion was defined, and there were some key approaches: advocate, mediate and enable, and some action areas outlined. And so the basic strategies: advocate, mediate and enable. And there are some action areas which I'll come to now. Building healthy policy, creating supportive environments, strengthening community action, developing personal skills, reorienting health services. We would suggest that we need to use these collectively when we're looking at improving any health issue or promoting health. And we can ask questions around these five action areas when we're looking at any issue. We can say, well, is there healthy public policy trying to address this issue? Do we need to develop healthy public policy? How do we create supportive environments? That might be related to healthy public policy, or it might be other action areas that we need to look at. How do we strengthen community action? Have we created a supportive environment enough to strengthen community action, which is very important? What do communities need to know? What skills have they got? What knowledge do they have? And how can we develop these further? And reorienting health services. Have health services incorporated health promotion in their action? What partnerships do we need to look at to reorient health services? So these are the five action areas that we use in health promotion. So what we can see from history, is that obviously health promotion focuses on the broader determinants of health, and we are concerned about equity, empowerment and sustainability, as we have talked about in this semester, using a systems thinking approach to promote health. And there are some other ways we can look at health promotion practice. We need to think about evidence, of course. We need to think about, what evidence is there around this particular issue, and think about why that is important. We need to improve equity, as we keep talking about. Community enablement lines up with one of the action areas about supportive environments and creating community action. How do we do that? And working collaboratively, as I've said, to reorient health services, working with partners, including the community, to address health problems or improve health generally. Evidence is key. Good quality information is key. We can use well-respected and reliable institutes or collaborations. The Cochrane or the Campbell collaboration are internationally recognised teams of people collecting evidence around health issues, including health promotion. The Deeble Institute is a great resource for health promotion evidence, but a lot of people collect data, including local governments, local health agencies, and we need to tap into that evidence, of which we have a great deal of now in terms of what promotes health and what determines health. And we can probably, we will develop our own forms of evidence as well, along with the community. We use, we need both qualitative and quantitative knowledge. We need to use unpublished information, such as progress reports, evaluations of health promotion interventions, to provide alternative insights into health issues. Regardless of the type of evidence, we need to ensure that, as I've said, we need to look at the evidence critically from all sources. We gathering information ourselves, as I've said, we have processes that can do that. We do a needs assessment or situational analysis. We look at assets of the community. We plan using theoretical frameworks that are robust and well tested. We implement the program, the project. We evaluate the project that we're implementing. We design the evaluation prior or along with designing the program, but we do a process evaluation looking at the how the program is being implemented, and we can redesign it then based on that knowledge. And then we say, well, have we reached our objectives, or have we reached our long-term goals? And so program planning and evaluation is very much part of health promotion. Inequity is avoidable, and change may be required to address the determinants of health, and that might be outside the health sector. So it's a key challenge for health professionals who often sit within the health sector, not in employment or education or environmental areas or local government. And so we need to, as I say, it's so important to work in partnerships. Community enablement. We need genuine and meaningful opportunities for people to work together to identify issues that need to be improved. We need to be imaginative in discussing various solutions to address these issues, and we need to develop interventions based on evidence, if at all possible. Professional knowledge is important, so is community knowledge in developing these projects and programs. Community enablement, as I said, how do we enable communities to become involved in a meaningful way? There are obstacles to this on many occasions. The priorities of funding bodies and the priorities of communities may not necessarily line up, or there might be a lack of time. It takes a long time to build trusting relationships with other organisations and with communities, and communities have competing priorities that require a good deal of their time, and people do a lot of work voluntarily, they're not paid. There can be confusion about roles, so we need to clarify all of this to create the right conditions for communities to be involved. And as I've said, the same thing applies really to working collaboratively with other organisations as well, but it is important. Better use of resources reduces duplication, share the load, and particularly in complex problems where different agencies have different strengths, and we can share, as I said, share that load and create some sustainable solutions. There are many great examples that probably you will have found by now in your research at both local and global scales where working collaboratively has meant success. Another way of looking at health promotion practice is the Continuum of Health Promotion Practice Program Planning and Evaluation, which really informs the rest of these on this continuum, using evidence and robust theories, as I've said, to create good policy, which creates supportive environments, which is done with communities to develop action for social and environmental change. We might need to think about health education and health literacy. We're moving in now to a behavioural approach. We might need to use social marketing or to increase awareness. We might need surveillance, often done at the global and national scales, but we might need to do things like increase opportunities for immunisation. We might need to complete screening or individual risk assessment. Moving into the medical approach for health promotion. Each of these are very important. It just depends on what the needs of the community are, which you will establish in program planning and evaluation. So the goals for health promotion sustainability are exactly the same, and I invite you to have a look at this diagram that gives some detail on promoting health and promoting sustainable development. And I also invite you to have a look at the World Health Organization, at the conferences that have been conducted over the years internationally, and see what the themes of those conferences are and see how they line up with the Sustainable Development Goals as well. All right, so a quick run through health promotion, and I look forward to talking with you online about this.